The current COVID-19 or coronavirus presenting case is complex and urgent due to the health impact as a result of this virus, not only in the United States but across the world. Thank you to the North Carolina and South Carolina Institutes of Medicine for having me to speak on the issue in regards to solution development moving forward for your states. Thank you for the presence and dedication of many diverse experts as working group constituents joining me today. Let us begin with problem analysis of COVID-19. In order to effectively address a problem, we must first understand the definition, unmask root causes, and identify populations and individuals most at risk. In this case, it is individuals with asthma, diabetes, compromised immune systems. No one is immune to this RNA virus. It is possible to experience a variety of symptoms, including loss of smell or shortness of breath. It is also possible to experience no symptoms at all. Testing in medical facilities or testing sites can diagnose coronavirus, but scientists explain that they still do not fully understand the spread and behavior, and this is dangerous. Since December of 2019, the coronavirus has globally caused hundreds of thousands of deaths. According to the World Health Organization, other problematic impacts of the coronavirus include shortage in much-needed medical supplies. It is currently understood that this virus is transmitted person to person through physical closeness, infected respiratory droplets, or touching contaminated surfaces, with no availability of an FDA-approved treatment. The top priority is to ensure the public health and safety in saving as many lives as possible from COVID-19 in states North Carolina and South Carolina. The CDC COVID data tracker allows us to take a closer look at cases and deaths in North Carolina. This tool also allows us to evaluate data influencing South Carolina in regards to COVID. We will evaluate solution options to help develop an effective action plan. Solution options include staying closed, partial opening, or a complete open for the states of NC and SC. It is vital to analyze and question which solution option best objectively addresses the disease burden and key metrics of COVID-19 for both states, which solution option yields more positive results versus negative consequences and barriers to avoid public health regression, ensure economic stability, and the public health of North Carolina and South Carolina residents. In evaluating solution options 1 through 3, the following evidence was kept in mind: lack of testing presented in missed diagnoses and increased carriers, increased spread, and increased mortality. It is also currently understood that global evidence reflects via the CDC metrics in New Zealand that frequent or mass testing results in less overwhelmed hospitals, better protection of at-risk populations, and a decrease in case fatality ratios. Furthermore, from a strategic solution development standpoint, evidence reflects economically and politically the impact of COVID-19 severity will share a direct relation with how quickly the virus is contained via authorities. It is important to include these objective definitions and evidence as part of the solution option evaluation process. The effective evaluation method followed was modeled after the CDC analytical framework. Before we arrive at the breakdown of each solution, glance over this evaluation table key. It's ranked from low risk to high risk. Solution option 1, stay closed for NC and SC criteria, was evaluated according to the public health impact, political and operational feasibility, and economic or financial impact relationships it would result for residents. The objective outcomes were recorded and divided into pros versus cons and ranked according to severity of low, high, or medium risk. In this solution, the risk was low to medium, and pros far outweighed the cons. Pros included decreased spread of the virus and availability of small business loans. Out of respect for everyone's time, this information is also available via a PDF for the option of a more detailed review. Solution option 2, complete opening, followed the same analytical breakdown, only solution 2 was ranked high to medium risk, challenges outweighed the benefits, and obstacles included resource shortages, increased mortality, and inability to meet possible future demand of virus testing. Solution option 3, partial opening, upon evaluation was medium to high risk, with barriers closely outweighing the benefits. Challenges included possible public protests for a complete open, struggle to enforce public prevention, and struggle to enforce hygiene or body limits at social gatherings and businesses to control the spread. There are many details, facts, factors, data, evidence to review and consider while taking part in this process, but thankfully the CDC analytical framework shed light on the best policy to follow for North Carolina and South Carolina residents, and that was solution option number 1, to stay closed. Solution option 1 presented the lowest risk ranking. It also yielded the most positive consequences out of all of the solutions and the least amount of barriers or negative consequences. As part of the action plan, I recommend implementing solution option number 1, staying closed, within the next 3 to 5 business days, and to communicate this clearly with the public. Moving forward, this low risk and most beneficial solution as an action plan can be communicated via the state governors to North Carolina and South Carolina residents and implemented over a 2 to 4 week time frame before being reevaluated with new and accurate scientific reportings in relation to COVID-19. Thank you for your valuable time, and please stay safe.